Del Webb. I've been coming to Dr. Amer, and all. And this is my sister. And she's been coming with me. We both were in a car wreck. In 2002, I had a major stroke. I could not bend my knees. I couldn't even bend down at all without hurting my knees. Now I can't. I'm sorry, I'm holding on to the chair with my back. But anyhow, I'm doing a lot better. I'm not using the tools I had to use to put my socks and shoes on. I'm not using those anymore. And I just think the world of Dr. Humor.
And now, you had the stroke in 2000, right?
Yes.
And you were unable to bend your knee from 2000 to 2000
Till now.
Till now. And you used to tell me when you were putting on socks, you had to basically...
I had to put them on with a special tool, and I'd have to put the sock on the tool, then take the tool and pull it up. Then I even had to take like a shoehorn and put my shoe on because I couldn't bend down to put shoes on.
Now for 17 years.
For 17 years.
I mean, and now you put your socks on.
I didn't put my socks on and everything else. I couldn't even bend my knee that I couldn't do before.
Put a knee on them.
On my other knee.
On our other knee.
And I couldn't do that before.
Now can you do this one?
What?
Okay. I mean, it's...
Hey, I just did that one. And that's the first time I've ever done that.
You need to practice on how to do that one. That one.
Now I'm doing it.
Okay, show her.
one more time? The other side? That's...
How you did better on that one than you did that one?
That's incredible.
And I haven't been able to do that for 17 years.
That's awesome.
Now your turn, sis. What?
Oh, I was just going to show, we do
He's
kneeling.
going to show how to do it.
We do kneeling on the shoulder.
So if I have a face, don't laugh.
So here we're doing just actually muscular needling in the shoulder. She's prone to injury. She drives a bus, and sometimes the vibration it just startle her joints, and sometimes the pain gets into her. So needling's been doing really good. What would you say your pain from 1 to 10?
I'll say 1.
1. No, I mean before, before we did this.
10.
She could even move her shoulder when she came in. So this is actually very easy. We actually take it in like this.
She's making a face.
Yeah, I mean you're definitely gonna feel it as it enters the skin.
I know.
But relatively.
Yeah, that one went all the way down to my elbow.
And sometimes when you want to take it all the way to the bone. Because you want to cross the whole basically width of the muscle. And we're doing symptomatic needling. So these are actually tender points that she's having. So these are symptomatic needling right at the areas of pain. And sometimes I could actually put it right in the joint line, the glenohumeral, and it's a shoulder, it's a ball and socket joint, and I could actually put it all the way in. And that will simulate blood flow right to the joint, right to the area. And you can actually take it and you can put it in an arc. So right around it. I'm going to put a 1 right there. Her pain is a 1. And once, you could tell that if you hit a joint versus a bone, the bone will have hard feel to it. A joint will have a give to it because the ligaments. But as you leave them, usually 10 minutes or so, you can take them out. If they don't want to come out, like I just put them in, they're obviously not going to come out. That means that the body hasn't, the full response, the full immune response hasn't occurred yet. When it's ready and the vasodilation happens and the blood rushes to the area, I should be able to take them out very easily. But here, see, I'm trying to pull on them, but they're stuck in there. they're not ready. Within like 10-15 minutes, I should be able to take them out, and then you know that they're ready.